Hello everybody and welcome to the channel. My name is Veronica and in today's video we're going to be discussing the different types of home care agencies that exist, going from companion care to non-skilled care to skilled home care. In the video I'll be explaining the differences to give you real-life examples of who might need each type of service and help you figure out which service is the best for your agency to start providing. Now, before we get started, it's also crucial for me to really stress the fact that regulations vary from state to state, and the scope of services can change depending on your location and the type of care you decide to offer. Many people reach out asking about one service but discover they need to adjust their plans based on regulations and client needs, so we're here to help you understand these differences before you start your home care agency. Now, the best place to get started is by talking about the services that are provided. Companion care. So this companion care agency's goal really is to provide emotional support and help with the daily tasks to their patients or their clients without necessarily providing any medical care. Companion care agencies really focus on this social interaction by providing companionship and engaging in conversations, playing games, and participating in hobbies or light physical activities, such as walking. Another thing that's important to note is that with companion care, you are able to provide assistance with daily tasks, helping with household chores, meal preparation, organizing schedules, and being of company to the client on errands or to medical appointments, as well as helping in providing them reminders related to their medication and supervision for safety of the patient as well. Non-skilled is a step above companion care, and the main difference is that when you're providing non-skilled home care, you are actually able to put your hands on the patient or the client and actually touch them. So when we're looking at deciding whether companion or non-skilled is best for you, try to keep this in mind. Do the services that my agency is going to provide require my staff to put their hands on their patient? Yes or no? If the answer is yes, you will most likely need to go for the non-skilled home care route, but if the answer is no, you can probably get away with just starting out as a companion care agency. These non-skilled home care agencies definitely provide more assistance than companion care agencies can provide, and they are for the most part for people that need, again, a little more help in their day-to-day activities. These non-skilled home care providers really do give hands-on assistance with personal care tasks like bathing and grooming, but it does not include medical services. So, for example, we have personal hygiene assistance. Your staff is able to provide assistance with bathing, grooming, brushing their teeth, and basic skincare to the patient, as well as helping them with dressing and mobility support, helping clients dress and undress, as well as providing assistance in transferring them from the bed to the chair and so on, if we're talking about a patient that has mobility issues. Another thing that's important to note is that non-skilled home care agencies are also able to provide assistance with prescribed equipment like walkers, but not with medical devices like oxygen tanks, etc., since this is reserved for skilled home care. Now, lastly, let's talk about the services that are provided by these skilled home care agencies. Skilled home care really involves medical services provided by licensed professionals like nurses or therapists. For example, if you were to have a patient that's a diabetic patient who needs regular wound care and insulin management, this would require a skilled home care agency to provide the service to that patient. You cannot do it under the non-skilled home care, nor the companion care. You would need to go for a skilled model. So this is why at this point you really want to start thinking about what are the specific problems that you want to solve within your community, because once you have that outline and you know what are the things that you want to be able to do for your clients, you're able to then go ahead and decide which business type is best for you. So as I mentioned, some of the services that these skilled home care agencies provide are related to wound care and post-surgical care, but they also provide medication administration, vital signs monitoring, physical and occupational therapy, chronic disease management, as well as coordination with medical providers. Now let's talk a little about who is actually providing the care to the patients. When you are a companion care agency, it is most likely going to be your companions, caregivers, and homemates. When you start a non-skilled home care, the people that are providing the actual care to the patients are most likely going to be home health aides, also known as HHAs or PCAs in some of their cases. Some agencies also utilize CNAs for this purpose. However, when we're getting into skilled home care, things change, and at this point, you do need to make sure that the care is provided by qualified medical professionals such as RNs, LPNs, PTs or physical therapists, OTs, speech therapists, or other medical professionals that are actually qualified to provide the service that your medical home care agency is offering. Finally, let's talk a little bit about the regulations, because I already mentioned that the regulations vary a lot from state to state, and a lot of people actually end up making the decision based on this. The more regulated the home care agency is, or the service that the business is trying to provide is, the more work it is going to be to get started, and chances are the more expensive. So this is definitely a deciding factor for a lot of people. Now, obviously, the more advanced the level of service you provide, the more regulated your agency is going to be. So starting out with companion care agencies, these are the agencies that are the easiest and simplest to start, and they have fewer regulatory and staffing requirements for the most part, with a lot of states not even requiring the agency to have any sort of licensure to operate. Now, when it comes to non-skilled home care agencies, they do have a moderate startup complexity due to personal care licensure requirements in some states, and they do have more staffing needs as personal care aides require specific training or certification. So we're looking at, as I was saying before, one step above companion care. You are gonna most likely need to go through a licensure process. Your staff needs to be more qualified than the staff you would need for companion care services, etc. And finally, we have skilled home care. When it comes to skilled home care, these agencies, out of the three of them, are by far the hardest ones to start, just because you are providing medical care, so obviously the liability is going to be higher. You are usually going to have to go through the Department of Health to get licensed with them. You are going to be required to have policy and procedures. A lot of the times you do need to also have a physical office space to operate off of, and definitely expect to be heavily regulated by both the state and also the federal government. Now, having gone over this, hopefully you do have a better understanding of the differences between companion care, non-skilled home care, and skilled home care, and are able to decide which business is best for you. In the next couple of weeks, we are going to be launching our program for those wanting to learn more about starting a companion care, non-skilled, and home care agency. And if you enroll in the program, definitely expect to get a lot of information regarding the step-by-step and how to succeed in this industry, which goes well beyond the licensure. A lot of people that we speak to on a daily basis, they are really worried about getting through that first step, which is getting licensed in most states, especially again if you're providing non-skilled or skilled home care services. But it doesn't end there. When you are thinking about running one of these businesses and you're trying to be successful within this niche, then you definitely are going to have to learn a lot of skills and have a solid understanding of how everything works. So hopefully with this e-learning program, you will be equipped with all of the information that you need moving forward to hopefully make your dream of starting a home care agency a reality this year. Now, if anything was not clear, or if you have any follow-up questions after watching the video, feel free to leave your questions in the comment section down below so we can look at that and make more content for you.